Welcome to Research MD. This is Dr. Pramil. I work as a Program Director in Internal Medicine, a Chief Medical Officer, also Associate Professor of Medicine. So we've been doing a series of lectures on in-service training examination topic. Very, very important to survive the residency. You always want to make a good impression of your Program Director, so start learning. Let's dive into nephrology question today. It's about the diagnosis of membranous nephropathy. Okay? So you got a question. I mean, usually, like, I'm going to tell you about a question. A 52-year-old man came with a sudden onset dyspnea, and this patient was taking NSAID, and the vital signs were stable, albumin is low, and then 4+ protein, right? Large number, that's the key, a large number of protein, and urine protein creatinine shows 8,900. CT of chest shows segmental pulmonary embolism, and the CT scans show renal vein thrombosis. So what is the best test for diagnosing this patient? That's the question up here. Okay. So when you talk about membranous nephropathy, there's a mnemonic. We just created the mnemonic. It's the first mnemonic I ever created. Just remember sex. Okay. Start with think about sexually transmitted diseases. You got hepatitis B, C, and syphilis in that category. S is the solid tumor. And S is associated with SLE, and S is in NSAID also. So things you need to remember in this. The main point is associated with the solid tumors. Remember the mnemonic, okay? Now, going back to this question again, like, what is, so if you look at this, so 52-year-old taking NSAID, remember the S, NSAID, right? Membranous nephropathy. So S, NSAID, okay? The next thing is the pulmonary embolism thrombosis, because anytime you have a tumor, what is the first thing you can have, like, a lot of thrombosis associated with. So the question is again, what's the best test for diagnosing this patient is renal biopsy, okay? So let's look at the kidney biopsy. What will you find in the kidney biopsy? One, you have to know what's in the light microscopy. You need to know what is the immunofluorescence microscopy, and you have to tell about the electron microscopy. Okay, light microscopy again. Membranous nephropathy, basement membrane, thickening, spike-like projections, okay? And then immunofluorescence, you see diffuse, uniform, fine, granular IgG4 deposits along the outer surface of all capillary walls, and anti-PLA-R2 or anti-DHSD7A, antibody positive patients, okay? And the electron microscopy is subepithelial localization, electron dense deposit. That's what you're going to find. Now, we got a nice diagram up here, well labeled what it is. Just make sure you know this very well, okay? And now, so let's talk about a little bit about the serum anti-PLA2R antibodies. Don't pick that answer as for a diagnosis, okay? This is a good one because we use it for screening. So diagnosis, you need biopsy. The question said diagnosis, pick the biopsy. Screening, you do serum anti-PLA2R antibodies, okay? Before any test, I always tell everyone, look at the sensitivity and specificity. So sensitivity is 58% and specificity is like 100%. Okay, so what does that mean? If the serum anti-PLA2R antibody is absent, you still need to do a kidney biopsy with the staining of the biopsy for this anti-PLA2 antigen to diagnose anti-PLA2 antibody associated membranous nephropathy. Let's say if you came back and the serum anti-PLA2R antibodies are present, okay? Consider kidney biopsy for the condition that may affect the kidneys present, if the course is atypical and all that. So the main thing, remember, if it is anti-PLA-R2 antibodies, you got your diagnosis. But if it is absent, you still have to go and do the biopsy. Now we just got like a nice diagram up here. You suspected the membranous nephropathy. First test you should do to screening is serum anti-PLA2R antibodies. Now, it can be positive or negative, okay? So if it is negative, if there's a strong clinical lab suspicion for membranous nephropathy, go and do the biopsy. Now, if it is positive, only time you need to do a biopsy is like, any other condition that affect the kidney or the course is atypical. Okay, so that is the thing. So again, going back this question, membranous nephropathy, remember, is a good examination question. They will ask you in the in-service training exam. Remember association with the sex, that means hepatitis B, Z, syphilis, and S is the other one, solid tumors. And remember, tumors can cause renal thrombosis, and association with the renal vein thrombosis, and association with the NSAID, okay? And look at that picture again, the light microscopy, immunofluorescence, electron microscopy, finding all of that you need to know. Very, very important topic. If you like our video, please share and subscribe. So we want to make like more and more videos like this, okay? Thank you so much for watching today. God bless.